hello, everybody, and welcome to Unlearning Out Loud. I'm Mike, and that far better looking person in my view, the upper right-hand corner is
Melissa Sadorf. Great to meet you all. If you are tuning in for the first time, then welcome back to our diehard listeners. We're glad that you're here, and we're excited to have some new faces on our quest today to unlearn some things, Mike.
Well, I think people are starting to figure out that our unlearning concept is a little bit of a ruse, in that we're tricking people into learning. We're like swapping out. It's we swap the idol for the sandbag, and but you got to clear out some old stuff to bring in some new stuff.
See, it's always back to the movies with you. Nicely done.
All roads lead to film. I can't remember anything important. I can't remember the stuff I'm supposed to know. Like when to show up for the podcast.
All right.
And more people in this room.
Moment here going on with the... But here's the perfect segue to the shirt. Where are we at today with the shirt?
I'm running late. I'm just glad I'm wearing one.
So are we.
Yeah. So, but I always have a smart blazer on, so I could still get away with it, I suppose. But so it's not a band. But it is a concept. And I thought after our episode that dropped yesterday about music and the power of music and how important it is in people's lives, whether they know it or not, I thought
support live music. I love it.
From, I don't know if you can read that.
Rock and Roll Hall of Fame.
Yeah, we had the pleasure of going to the Rock and Roll Hall of Fame a while back, and I saw that shirt, and I'm like, ooh, I have to have that shirt. And so I have that shirt. And just because it has that little stamp on the back means I probably paid $25 more for it. It's a pink shirt. You can get this shirt on the website, on the brand website without that on the back. And I'm pretty sure it's half the price. So
very nice. Very, very suave.
I need to unlearn some things about spending. So, hey, let's introduce our guests. What do you say?
I love that.
You've had an extra half an hour to get to know them. You could probably run through a complete bio. It's not even so we're super excited because today's topic is around health and medicine. And, even though Melissa and I like to try to stay as healthy as we possibly can, we are far from experts. And we like to joke that we're doctors, but just not those kinds of doctors or medical professionals or anyone else. I can give you advice, but it's usually about how to conduct education research, which is completely useless to most people. However, we have two people in the room that can give you informed information and advice. And in this day and age, is there a better time to be talking about where to go to get real information than right now? So let's start with, I'm so excited. These are two people that I know well, and I know well enough to say they are top of the list of people you want to be talking to about the real world and that intersection, as they say in academic circles, between reality and science and medicine, and translating that into a language that people can understand. So let's start with, I first want to introduce Julia, whose last name is, coincidentally enough, Lee. And that's because he upgraded our family by marrying my cousin. How long ago was that now, Julia? It's been a while.
It was 2003, so it's coming up on 23 years. Yeah.
And then all you got to do is get your kids to 18, and then you can run to the hills. You just
one down, one to go.
Yeah. Two beautiful children, and as much as I tease about my cousin Sean, is a wonderful human being. Julia is probably just that much more of a wonderful human being than Sean. Don't tell him I said that, and hopefully he won't listen. But Julia, you want to tell us just a quick background? Who are you? Why would I have invited you besides your family and you're awesome?
Oh, well, thanks. Well, those are the most important things. No, I'm a nurse. I have done cardiac nursing my whole career. I am specifically an electrophysiology and cath lab nurse in a hospital. So I do procedures. I take care of people who have heart problems and fix them. So it's really fun. It's really nerdy. Electrophysiology is super nerdy. And we are a room full of very OCD people. So it's really fun. So I'm excited to be here.
That's awesome. Just real quickly, that electro, blah, blah. I hear cath, anything with the word cath and medicine overlapping, and I get a little puckery. What exactly is that fancy word you just used that I can't say?
Well, there's two sides to cardiac. You've got plumbing and you got electricians. So I used to do the plumbing. So that's heart attacks, stents, all that kind of thing. Now I do electricity. So it's the heart rhythms of the heart. And so we fix the abnormal ones. We put in pacemakers. We fix holes in the heart, that kind of thing.
Okay. So the important stuff for sure, right? Mm-hmm. And because you watch The Pit, I know about the importance of rhythm.
Yes.
Oh my gosh.
There's good ones and there's bad ones.
Oh.
Yeah.
All right. You can, of course, try to dance.
And our next guest.
Yeah. This person is also amazing and coming to us because we're in Phoenix, Arizona, and you can do this here as opposed to, the millions of listeners we have on the East Coast. This is a good friend of mine, Shelly Batra, who is, I'll let her tell exactly what has her in the room today. But she's a wonderful human as well. We met years ago, and I'm just so excited that she's here. So, Shelly, you want to share a little bit about yourself?
Hey, well, thanks for having me. I'm happy to be here. Shelly Batra. I'm a pediatrician by education. Chose to do hospital-based pediatrics instead of being in the clinic. So I get to see all the sick kids that come in. Take care of kids from 0 to 17 years and 364 days.
I love that marker.
Yeah, very important. Let me just tell you.
On your 18th birthday, you're out.
You're out.
I one time years ago, I said to Shelly, we were talking about something, and I did that whole, that you do passive aggressively when you know a doctor, and you kind of like, well, I wouldn't want to, but it's well, keep in mind that I am a pediatrician. I said, well, I'm the size of a child, so
I can put that on my resume, like personal physician too, might be like that.
Yeah. Well, at least I tell people that that's what you are. That you are. So if you get sideways glances from other people, you'll know where that's coming from. All right. All right. Well, I think we just need to jump into the show then. So let's get going. Now, but before we do, we have a little segment that we like to do called Stuck in My Crawl. And it's things that just have we like to think of it as the kind of the Larry David / Seinfeld, something that's just been bothering you, and that you would love to just say in a public space and have some fun with. And so Melissa and I always have some, because we like to think of ourselves as like those two old men Muppets up in the. Do you guys remember the old men that would sit up and make fun of everybody and just that was actually the original idea for this podcast, that we were literally just going to just and
rant.
Rant. And I thought, well, no one wants to listen to the old man on his patio yelling at the cloud kind of thing. So we thought, well, let's just nestle it inside of a podcast. So Melissa, you got anything that's been sticking in your crawl lately?
Well, I have taken to doom scrolling, which is something I'm not proud of, but I do have to say that, what do you do in an airport, right? For 2 hours waiting on a plane that's delayed.
Drink scotch.
Well, then I wouldn't make the flight, so doom scrolling might be better. But one of the things that just happened, right, is it's now the year of the fire horse, and which is great. It's like forward energy, and things are going to get done in the next 364 and a half days or what have you. But I didn't know about the year of the snake, which meant that all of the stuff that I was supposed to be offloading and the decluttering and the getting rid of bad habits, I didn't know that I was supposed to be doing that for the past year. So I found out about the year of the fire horse 2 weeks before the year of the fire horse started. I had 2 weeks only to do decluttering. You should see my garage. It's like boxes.
Did you power through?
I did. I didn't get it all, but I got a lot done in 2 weeks because I'm like, I got to get this done. To be ready for the year of the fire horse. Yeah. So and I feel like I was gypped out of some cosmic kind of, invitation to be a better person. And I missed it. I just missed it. So,
okay.
Yeah.
So that's legit. My crawl is people that use the word gypped.
All right.
I haven't heard gypped since
Glad
somebody used to say no duh back in like 78. Remember, you made such a no duh. That was our and girls would say no duh and boys
I said
would say
that
no
last
duh.
week.
Yeah.
Maybe
Right
I'm
after-
stuck at a time warp. Maybe it's me.
Yeah, well, so that's pretty fair. You need one of those paper calendars that kind of give you warnings in advance of what the year comes.
I know. Well, or I need to follow the Chinese lunar calendar. Either one.
Well, you just need one more thing added to your list of things to follow, apparently.
Yeah.
You being cluttered is probably as likely as Julia being cluttered, but that might be another episode on unlearning what you need to save and what you don't need to save. That's great. Well, so I have one. My brain is just a running, it's just of just nonstop crawl issues.
It doesn't sound like you at all.
And most of what I don't talk about is many of my crawls are actually, I stick in my own crawl constantly. Like I am just so good at making myself miserable. My natural instincts are exactly what I hate most of the time. Like somebody's like, oh, you must be comfortable in, having stuff, wherever. No, I hate it. I just really good at putting stuff wherever and not being able to find it. I am like
you need to declutter. You should have been paying attention to the year of the snake too.
Yeah, well, there's a lot of things I should be paying attention to. Lots of inside jokes coming on this episode about people that, anyway, especially someone who's never late, but on Saturdays, apparently I am. Don't count. So I wanted to revisit an earlier crawl just for a second.
Okay.
Because I to do this because I was going to talk more about my problem with indexes in books.
Okay. All right. I'm glad that you're doing that and not naked men in the gym.
Well, it's funny you should say that. And no, we did not plan this, but yeah, it's funny you should say that because yesterday. So, ladies, I don't want to make anyone uncomfortable, but in an earlier episode, my initial stuck in my crawl was people who are naked in the gym locker room longer than they need to be. Like understanding that, yes, there's a point that you're supposed to be changing clothes, but there are these people that just are clearly getting something extra out of the time they get to spend walking around naked, supposedly without. And there was someone that just yesterday took it to another level. And I'm not going to say too much, but let's just say that there were angles, there was dimensions of field of view that were completely out of line or in line. I just went, and it was probably the biggest offender of my many, many years on this planet that I have ever seen in my life. And again, I don't need to go back. Just go back into episode 1. Listen to my fundamental problem with these people. And yeah, I said these people. These people. And then I won't need to explain anymore. And just take the person, the hypothetical, the archetype that I described in episode 1, put it on steroids. I don't mean physically. And then just let your imagination run wild. I'll get back to my problem with indexes in our next episode.
I was going to say, how does naked men and indexes work together? So I'm glad that you did.
I'm sure I'll find a way.
Separate the two so that I'm not wondering here.
As the academics would say, in the intersection between naked men
and indexes.
Yes. So that's a running joke on the show as well, ladies, if you haven't heard. I'm sure you've listened to every minute of every episode we've done, but I do get a kick out of academic speak where it's kind of a, I don't want to say a virtue signaling kind of thing. It's like a signaling thing that I belong in the room. There's certain phrases that come in and out of vogue that you're supposed to use. And I do it all the time myself. It's just kind of like an infection that you pick up, to use a medical analogy. And right now, the term that you're in a room with people who are highly qualified or deep thinkers is, let's discuss the intersection. That's the buzzword right now. What's the intersection of this and the intersection of that and that. So I'm just gonna, next time I walk into a room full of academics, can we talk about the intersection of naked men at the gym and indexes? to be careful in disease. Ladies, this is a podcast where you can use inappropriate language. We just have to stamp it later. So don't worry that if something bad comes out of your mouth. So the last guest called me an asshole right off the bat. And so we just knew right away that was going to be one that needed a stamp. So, all right. So let's get into this. What do you say?
Let's do it. Well, do you guys have anything that you want to get off your chest as far as being stuck in your craw?
No, that was it.
The lady.
Mike. Okay.
Word. Julie and Shelly. Maybe they have something that they need to.
I mean, I'll go again if you want, but
I'm not sure we have anything this week. Like, there's usually
construction. I'm tired of the construction. That's it.
Yeah, that's fair. I think we all, and people all around the country probably just, no joke. How many times do you need to expand the same road? And why didn't you just start with a wider road when you knew it was going to be that way?
And why are they doing it on a Saturday morning? Yeah. Like, I don't understand this.
Yeah. Well, and sometimes so we do talk about, cognitive biases on this show. It's one of the kind of the benchmarks. And I do laugh at myself when I do that kind of thing, because I'm like, I will complain about it if they do it on Monday. I'll complain about it if they do it on Wednesday. And then if they do it on Friday, I'm going to say, don't they know Friday traffic's crazy? Can't they save it for the weekend? And then if they do it on the weekend, I'm going to go, don't these take a weekend? I'm going to have something to be, there's going to be an angle that's going to displease, going to vex me one way or another. So that's very good. And again, looking at the backdrop for Shelly, which isn't a backdrop, those of you in New York, that is real Arizona weather here in February. There's something that's stuck in my craw. Why is there an R in February? Can't we just take it?
You think so?
Yeah, I'm just going to propose.
Everybody spells it wrong because of that. So.
Yeah, February. Or just start using it. Let's just use it until it irritates people, and then they take it out. It's passive-aggressive assault on spelling problems. I like February. So, that reminds me. Don't let me forget. I don't have my pen handy, but I've got a stuck in the crawl, and it has something to do with removing the letter T from words. So we'll talk about that.
Oh, all right.
Yeah. So let's talk about today. I'm super excited because we want to talk a little bit today about a serious topic, but we're going to have some fun with it, which is how important. I mean, everyone knows how important their own health is, right? Like, we all know that you got to take care of yourself. You got to. And we know that as humans, we have a hard enough time doing that as it is, right? Even when we know that something might not be good for us, we tend to still sometimes do it. So that's a problem. But then it's even worse when you don't know where to go to get like good information, right? And so we thought, let's have some fun today talking a little bit about the concept of like, what are some things that these two practitioners see in the real world they are experiencing, and that they just think, God, I wish people could unlearn, right, these concepts, these things that they come to me, or they end up needing to get plumbing or electricity done on their heart, to use terms I understand, Julia. And that if only they knew. And one of the things that sparked this idea for me was Julia having a conversation with me one time in an Uber on the way back from dinner with the family, telling me about some things that were affecting young people and their hearts, and things that you wouldn't associate with young people and their hearts. So some of the underpinnings of this episode are some things that we like to talk about, the intersection between psychology and behavior a lot. And we know there's some things at play in terms of an information that is an environment that's drowning in information and misinformation. And why is it that we tend to absorb and internalize stuff that may not be true, even if some of the evidence is screaming to the contrary that it's not true? And we've talked about, and we'll hint on this a little bit, and we'll come back and do a follow-up on this episode and kind of process it a little bit more about confirmation bias, right? That the brain is designed to validate things that it already thinks, right? If I think I've got a brain tumor, I'm going to go into the, onto the interwebs and talk to Dr. Google, and I'll find other people that think they have a brain tumor, and everything, that all the symptoms that I have are going to point me to the fact I've got a brain tumor, and then I'm in Shelly's office, right? Having a brain tumor, and not wanting to listen to evidence of the contrary. There's also the idea of the ambiguity aversion, the idea of like, I don't like uncertainty, right? We've talked about the brain being an energy conservation machine. It doesn't want to use any more energy than it has to. And so if there's ambiguity or the answer is complicated, no one wants to hear, well, it's complicated, right? Or the odds say this, but it doesn't mean you shouldn't do that, right? Like no one wants that. They want clear cut and definitive answers. And in this environment, in this media landscape, and in this social media and this AI landscape, there's a lot of, hey, I can give you a black and white answer. That red light panel will solve all of your health issues, right? Instead of, well, maybe it could help you with this, but there's no evidence that it could help you with that, right? Well, that's too complicated. I'd rather just buy the red light panel and feel like it's going to, make my 55-year-old self get taller out of the blue, right? Yeah, I'm looking for that kind of that panacea, right? And then there's also an angle that we thought was interesting that could be a little bit fun to talk about today, is this idea of kind of this cultivation theory of this idea that stuff that we see on television we think is real, right? And I laugh about this idea of a reality show. There really is no such thing as a reality show, because who in reality has TV cameras following them around? No one. So their behavior by default is not realistic, right? There's a certain performative nature to what's happening on screen. But we are all pretty big fans, I think, of who doesn't love a good medical show. I mean, we are hooked on The Pit right now for sure.
100%.
Yeah, great show. And, and who doesn't love a dose of Noah Wiley, every Thursday night? I mean, come on. I saw those eyebrows raised there, Shelly, a little extra. Yeah. And so there's also that. So how are these people that are showing up in on the table for Julia or in the office for Shelly being influenced by how much of what they're walking into the office with is already influenced by something that may not be might be relevant. So we thought, let's get some real people in here. Let's get some experts in here and talk about some things that are going on. And so let's just jump right to it. There's some more psychological underpinnings we're going to get to, but we'll come back. We won't make our two guests spend any more of the time they already lost on the front end of this episode having to sit and listen to that part, but we'll do it as a follow-up. I think it'll be really interesting to process some of what we talk about just back among lay people like Melissa and I when it comes to medical stuff. So Julia, let's start with you. When I first threw this idea out to you, I said, hey, if you could tell anybody something that they think they know about, your field, and you could kind of like correct the record, what was maybe one or two of the first, let's just start with one thing. What was the first thing that you thought, yes, I've been dying to tell everybody on the planet, fill in the blank?
Yeah.
Came to mind.
Well, I think people need to unlearn that more information automatically means better decisions. That's not the case. Googling symptoms and trying to figure out supplements or therapies is not the same as understanding your body in context. And medicine isn't cut and dry. It's very nuanced. It's patterns over time. It's risk versus benefit. It's male versus female. It's young versus old. And none of that is found on a Reddit post. None of it. So I want patients to be engaged and be curious and be aware of their symptoms and their health or lack thereof, but I just don't want Google and TV dramas to replace shared decision-making and real conversations.
That's a great one. I know that's a refrain I've heard from people in all kinds of fields, including medicine. And we're gonna kind of go back to what you just said in a second, but let's hear what Shelly, what came to mind for her first. Same question for you, Shelly.
Well, I mean, I echo what Julia has said. It's, I think one of the things that as a pediatrician in a hospital that I deal with on a very regular basis is these families that come in with they think it's a McDonald's menu and they're like, I want this, 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 and this done. And if you're not going to do it, then I'm going to, we're going to leave against medical advice. We're going to sue you. We're going to do all those things. And that's not the way that it works. There is a there's a pathway to reach the answers that we need and want to, in order to treat.
Yeah. And so what I'm hearing from both of the theme from both of your answers, and this was not pre-planned, was there's a certain level of patience that has to be involved in taking this journey. You just said pathway, right? And Julia alluded to the same concept of this is a journey. And so that jumping to conclusions, one of the things that I always get a kick out of is I always said to somebody, if you think that, if you think that Advil is causing you to, have this weird issue and you go online to validate that, I guarantee you'll find someone in the universe that is posted on a Reddit post that Advil caused them to have this issue. And there is somebody on the planet, for those people who do research, there are outliers where somebody will have a weird reaction that no one else has, right? It's just that statistical, like that anomaly that happens in the human body, especially, or any science. And then guess what? The people, that small sliver of people that happens to, they don't usually sit quiet. They find an outlet, right? Where can I put this? Where I don't know about you guys, but the 10 million times that I might have taken an Advil, don't worry, I haven't taken 10 million Advils, or I would be in your offices. Don't go online and post about their great experience with Advil, right? And so the internet is going to be loaded with information that would cause people's hackles to get up or their crawls to get stuck into. There's that expression again. And so that really feeds into that. And so I want to just jump back in. It kind of goes right with what you guys just talked about. Do you, let's spend a little more time on doing your own research, this idea of doing your own research, because what I don't want to do is give someone the impression, because I know that there is the cynic's perception of the medical profession. And I'll just play the cynic because you guys, I'm sure, have heard this angle, right? Which is, this is an industry. These are people trying to make money, right? There's no money as Chris Rock said, there's no money in the cure. The money's in the medicine, right? Like all this cynical. Right? And sometimes, again, some of what people say is true, right? I'm sure you can find, instances where pharmaceutical companies may have withheld this or what, right? That the anomalies may not be the norm, is what people, right? To kind of make sure I say that on the front end. But this idea, though, that the cynic then broadly applies this concept that essentially what's going on is this is an industry designed to empty them of their money. And that if they've done their own research, I like to call it the Aaron Rodgers syndrome, right? I have Google, so I know that this is the case about, you name it, vaccines or AIDS or, you name it, cancer, right? Everybody thinks they found, right, the answer. And so I know you kind of alluded to it already, but from your experience, what are the kind of the dangers, if you'd like to go into it further, of the doing your own research, and what are are there benefits to it? And if they are going to do their own research, what are some healthy ways to approach that? Like, how should they tackle it? So Julia, we'll start with you.
Yeah, I think in this day and age, this is just how life is. We have so much information in our pocket, on a phone. Like, it is the world at our fingertips. And that's a good thing. It's a bad thing, or it's otherwise. We're not sure yet. So I think doing research is really good. I do my own for my own health, for my own kids' health, for other people when they ask me about things that I might not know 100% about the condition. But where are you getting that information from is the most important thing. Somebody on TikTok is not going to be right. I'm just going to tell you that right now. Whatever they're hawking on their TikTok shop is not the answer, is not the cure. And that kind of stuff can be really dangerous, because now maybe your doctor gave you a pill or a treatment, and now you're going to take this supplement or do this therapy that actually might harm you more. So if you want to do your own research, that's fine, but it needs to be evidence-based. It needs to be from a reputable source. And then you take that information, and before you use it or do it, you ask your physician or your nurse practitioner or your PA, whoever you see, is this right for me? Mm-hmm. Is this right for my condition? Mm-hmm. So
good. Mm-hmm. Shelly?
1,000%. I don't know. I'm not sure that I can add much more to what Julia said. It is the number of, I guess the younger generation at this point, since that's what I'm mostly dealing with, that come in and say, well, I saw it on TikTok and Snapchat and Instagram, but on my Facebook forum, it says that I should do this, this, and this, but you're not recommending any of those things. And I'm like, but where's your New England Journal of Medicine article? And I'd be happy to read that. Or do you have a reputable source? I'm happy to take a look at it with you, for you. And then we can talk about it. But that's not what anybody's interested in.
Do you think that this is something that I've said before, and I'm always curious about the application to a particular field. Do you think that some of that stems from the idea of not understanding what research actually is? That searching on the internet is not research; those aren't the same things, and it's really the vocabulary doesn't serve us well. And I think that the flattening of the idea of research that I always laugh when I hear Aaron Rodgers say he did his own research. He clearly doesn't know what research is, right? And how exhaustive a true research project is, and that a real research project contributes to a body of information that isn't definitive. It's usually pointing towards probabilities, right? That based on the evidence that we have available right now suggests fill in the blank, right? And that doesn't mean that I'm telling you it's guaranteed even, but would you say, isn't it kind of, I've always understood it to be like it's almost like the obligation of the medical professional to try to say, to try to make it clear that, I'm not saying that there isn't something out there we don't know. What I am saying is that based on the preponderance of evidence and this intersection between when you got sick and what we know at that moment, this is what we know. And this is the likelihood that this is what's happening. Does that apply is that the same thing in your field? Is that what you're seeing?
Yeah.
Yeah.
Yeah. Absolutely.
Okay.
Yeah. There's a reason why we call it a practice.
Right. 100%.
Yeah. Because what we knew 50 years ago has drastically changed. And why? Well, because our technologies are better. We've developed new medications. We've developed new therapies. But also our bodies have changed over time with the food we eat, what we do for a living, what we're exposed to. So all of that has to keep changing. So,
Yeah. And I think the idea that that some of it, I think, is probably media driven, because the media does present medical information in every singular study like it's definitive proof, right? That, well, on Tuesday, scientists in the medical community told me wine was good for my heart, but on Thursday, they're saying it causes Alzheimer's. Well, this idea that there isn't this monolith, first of all, some guy in the sky with white hair that says science across the front of his shirt that says, today wine is good for you, tomorrow it shall be bad, and I do this just to mess with you, right? And I think that one of the disservices, it probably makes you guys want to pull your hair out as basically scientists to see it misrepresented in such a way that, psychology says today, and scientists are saying today that, no, it's just another stack of evidence to go into a massive stack of evidence that we need to continue to constantly evaluate, and that science isn't a destination, it's a process. Right. And that we're always moving towards some sort of closer to understanding. And then to Julia's point, that understanding may end up needing to change because the people involved changed, or the food they're eating changed, or the non-food they're eating changed. Right. That kind of thing.
Well, take, for example, just recently, if we're going to talk a little bit current event is, the whole thing about Tylenol causing autism in pregnancy. Right. At the beginning of, what was this, like December or so, this is when all of this stuff came out. And last week, the government puts out an article and says, or not an article, but puts out a post that says that, Tylenol doesn't cause this. And all of a sudden, everyone's like, oh, okay, well, then I'll take it again. But there's no new evidence. There's no new articles. There's no new research that's been done. It's just somebody said this. But it doesn't matter. It doesn't matter that it was your pediatrician or your cardiologist that told you to do it. It's that, someone even higher up than us has decided that it was a problem 3 months ago and now it's not.
Right. Right. And the idea that then that follow-up post isn't going to get the attention that the initial one's, right? So many people are never going to hear the retraction. right? They always hear the initial assertion, but they never hear the retraction. And just to stay in this space a little bit longer and to use some other examples that people, I think that the COVID experience was used by a lot of naysayers to point to the medical community as, somehow, underserving the population, which, I found particularly frustrating because essentially this was, you two were frontline workers through all this, right? You were the ones that were in there during the mystery. Julie, I remember seeing the pictures of you coming out of your shifts with your face from where that, like, it just looked so painful. And there you were doing, 12-hour shifts. And this idea that, and some of the examples I thought that really came out of that, some tangible examples for people to kind of check their thinking was around masks, around vaccines, and the misunderstanding about what was actually even said in the first place, right? And so and the fact that when let's say a health professional is on TV saying, someone says in the media scrum, so should people just take off their masks because they're not doing any good? And the health professional says, we cannot say that. We do not recommend that. Right. But then a couple months later, some of the information is like, well, it is turning out that it's more about the person who's sick wearing it to keep it from spreading than if you're wearing it, it's going to stop it from getting in. And like, it became more complex as they were looking at it more carefully. But then they go back and say, see, that guy lied to me. But what I always try to say is, no, that guy was being asked as a medical professional based on, can you tell people to throw away their mask? And the answer is hell no, right? And even with this other question coming up and these new questions coming up, these are questions not, throw your masks out, people. We have a novel virus that is ravaging the world right now, and we don't know how much worse it's going to get. So let's choose the riskiest path. And me as a public health official, right? I mean, what's got to be going through someone's mind is I have a responsibility not to put out reckless or like information that is not been definitively proven. And can you imagine if a health person had stood up there and said, it probably doesn't work. And millions of people took off their masks that next day, right? What that would have meant, right? And so the obligation of someone to say, I can't make a blanket statement about taking off your masks, right? Knowing that there's repercussions that come with that, right? So I know, I mean, masks are still a thing in your business, right? I would say as long as my doctors continue to wear it, I'm going to wear mine. And if there's any doubt, and they made me break out something awful, but I still have the
perfect skin. What are you going to do?
Yeah. No, I have the skin of a 16-year-old except for the sagging part. So I think that's all interesting because again, we move into the area of, and this is a broader topic that we talk about, this area of trying to pull science and pull anything we can into the rage economy and into the divisiveness, because that keeps people coming back to that Julia's TikTok page, as she was just talking about, or keeps them coming back to, right? But unfortunately, this rage economy generates misinformed people. So, awesome. Okay, so we might be able to talk a little bit more about that, but let's have some fun. We talked about the pit. Yeah. Okay. So,
but I haven't watched Thursday's episode yet. So
okay,
that's Thursday.
Me neither. So
no spoilers.
We won't talk any spoilers.
I won't tell you. I watched it last night.
Okay. Other than Shelly will tell you that I'm pretty sure Noah Wiley looked great in it.
He always.
Yeah. So hey, let's talk about the nurses. Because the one thing I do think is great about the pit, better than anything I've seen so far, is how nurses have been portrayed. And, I'm old enough to have seen decades of medical TV, and the evolution of how nurses have been portrayed feels like it's getting closer to the truth. And what my own experience with nurses and nurse practitioners are, which is they've actually done a lot of the actual work that I've had have actually been handled by nurses. And I'm thrilled when I can see either one. But media has often, and entertainment has often portrayed nurses as, the person that clips the little bag up on top, whatever, the drip bag, and they do this and they do that. But it's really a doctor that's that's really, behind all that. The pit has been showing a total different idea about what nursing and the role that they play in and so Julia, if you don't mind, talk a little bit. And I know you're talking about more than just your particular role. You're obviously in a high specialty area with the cardiac nursing, but nursing in general, like how does it diverge from what people might know or think they know about nursing as a field?
Well, I think in my being in hospitals, but I think if hospitals really were like they are portrayed on TV, like it would fall apart in a week. Like that's not really how it goes. It's far more collaborative working as a healthcare team than really, the doctor says this and the nurse does that. That's not really how it works. And, nursing is really a special area. I don't feel like everybody can do it. You hold hands, you listen, you see details, and you're gathering it all in. And you're with those patients for a long, long time. Now, I haven't worked on the floor in a really long time, but so, I might be with a patient for 2, 3, 4 hours, but you're relaying information to physicians and to nurse practitioners that work with those physicians because you're the one seeing it and gathering all that information. So, I'm a big soccer fan, as you know. Yes. So, nurses are kind of a goalkeeper. We stop things from happening. We're defense. We are strikers. We make the first move to say, hey, there's something going on here. You need to fix it. That kind of thing. So I think the Pit does a really good job with nursing and showing how independent we have to be and can be, but also how collaborative we have to be with other practitioners in order to help the patient. I mean, that's what we're all there for, is to help the patient.
Yeah. Yeah. And I think the thing that the Pit that I noticed right away in particular is and of course that's a trauma center. I know that they're representing there, but how that collaboration between Noah Wiley's character and the lead nurse. And she's really, it kind of reminds me of and Melissa, probably you too, of when we were principals and how important, that administrative professional was. And there were many people like, I could have not shown up. As long as she shows up, the school could keep running, kind of thing. It's so pretty interesting. So that's a really good. Shelly, any perspectives on what you see in terms of nursing and the role they play?
Yeah. I mean, even from the time that, from doing residency, like you're taught in residency, like your nurses make or break you. So if you are not willing to work with them, if you are not willing to learn from them, you're gonna drown. Like I remember a nurse calling me at like 2:00 in the morning as a resident who'd be like, oh, I need a Tylenol order. And I'm like, but you already have a Tylenol order. She's like, I don't care. I wanted I wanted to wake you up and tell you that your kid's got a fever. And I was like, okay, but you already have an order. And I realized that I had said something not so nice to her, a couple days earlier. And I mean, from that day on out, you don't make comments about your nurses. And if you have an issue, you just sort of like, you take that to another day. It was a bad day for you, a bad day for her or him, whatever. But I mean, your priority is your patient. And they are, I actually love the way that the nurses on the Pit are portrayed, because that charge nurse, she is exactly what like an ER needs. Mm-hmm. Yeah, you need somebody like that who knows everything that's going on, what everybody's doing, who keep track of everything. Like they're savants.
Yeah, that's pretty cool. And I can't say enough about all the experiences I've had. And I'm somebody that I feel like I've had great experiences with the medical profession in general. But my God, without it's just something else. So I see collaboration. That's what I've witnessed is collaborative. I don't think I've seen a relationship. I'm sure it happens, but at least I've been lucky enough to say that the relationship between nurses and my doctors have always been seemed strong, or at least if they were arguing, they were doing it in the hallway before they walked in, which is great for my sense of well-being. So I want to make sure we talk about something that is probably relevant to a lot of people. I want to go to you, Julia, on in terms of cardiac care. And I know people will say, the heart and the brain, I know, usually at top of people's mind on things that they worry about, even though we don't always make great choices, but still we all know in the back of our, minds that these are really key pieces. Of course, it's a system, all of it has to work. But in terms of cardiac care, and especially around the idea of, warning signs. What are some of the silent symptoms? I know we talked about watching TV. People see the made for television heart attack, right? Right. And so, but what are some of the things that I know, I think I've heard you say over, dinners at, if somebody just had noticed this or paid attention to that, it might've been able to really help them, down the road. What are some of the things that you think you wish people were paying attention to that might help maybe save a life or just, save some inconvenience, if nothing else?
Well, this is very apropos because February is Heart Month,
Well, I thought it was Year of the Flaming Dragon or whatever.
Yeah, that too.
Yeah. Yeah. No, I think, television likes to portray the big heart attacks, the clutching chest, the left arm pain, they collapse, that kind of thing. And that happens. I'm not going to say it doesn't, because it does, but it's not always what happens. And I think it's the smaller things that people don't notice or just say, it's really not that bad, so I'm just going to let it go. That's when it gets really dangerous. And a lot of times that happens in women or people that have already had an event. They're going to have different symptoms than your normal middle-aged white man, to be honest. I mean, that's what is shown on TV a lot. Yeah. So it's things like a little shortness of breath when you're not really expecting it, or indigestion. And maybe you did just eat something that didn't agree with you, but you know what? I've never had that before, so why am I having it now? So I think people need to really pay attention to their own bodies, because some signs can be really subtle. And whether you have a family history or not isn't always doesn't always work in the algorithm, because what your great grandfather ate and how he exercised or didn't isn't what you're doing now. So that isn't always going to be truth. So I think missing those subtle signs can delay care, and that's when you can get into some real trouble.
Julia, can you talk a little bit about how women are different in terms of their signs and symptoms than men?
Yeah, absolutely. Women tend to have anxiety as a symptom when they have a heart attack or a heart event. They can have shortness of breath, indigestion, gastric problems, that kind of thing. They maybe won't have like the left arm pain. Maybe it's in their back, which also can be other things. But, it's not always your classic chest pain symptoms. So.
Yeah, great question. And it's just so important. And that kind of leads a little bit to, my next question, which is this idea of prevention. And I know that a lot of people would think that, well, that's boring. And they certainly don't do shows about prevention, right? And so it's not entertaining as a conversation, prevention. But, the idea of, taking care of yourself, what are some of the things that just, that you wish, let's just I'm going to kind of blend two ideas that I had for questions, which is about the idea of people kind of over preventing and, maybe, the conversation around supplements, et cetera, et cetera. What are some things that maybe you wish people could unlearn about prevention in terms of trying to maybe potentially doing more harm than good, or not doing any good at all, maybe even if it's not harm. And then maybe some things that they should be doing for prevention that, even though they might seem boring, and it could be heart health, it could be brain health, it could be overall body health. And we'll ask both of you guys. So whoever wants to go first. Look at you both.
Vaccines, please.
Yeah.
I mean, obviously in our space, like this is the talk of the town right now is vaccines and stuff. So it's vaccine. I am very, I'll get up on my soapbox and pro-vaccine all the way. That being said, having those conversations with, with a family about why they have hesitancy or what they've learned about or what their experience has been is a super important portion of that decision making. But I mean, in our space, that's the biggest thing. Kids don't need a whole lot of supplements. Kids, a multivitamin a day, generally speaking, for an otherwise like healthy kid, they don't need anything else. So I think that parents often try to do what they're doing for themselves, for their children. And it's not necessarily what's needed, or it's unnecessary.
And can that be harmful then?
To some degree, depending on what where they've gotten their information, what kind of supplement or something like that they're using. Yeah, I mean, because I think there's I'm losing my words, but like the concept, there's a misconception about that children are just small adults, and that so the medicine that you apply in adults can be applied to children, but just in smaller doses. But that's not actually true. It's just a very different system. This is why there are pediatricians, and that's why there are adult physicians.
Yeah, that makes a lot of sense. And I think that you hit on something. And I know people are going to say, well, we talk about this isn't a political show. This is a show about people. And
Absolutely.
But politics is people. Essentially, it's a manifestation of people. And so one of the things that has always made me wince is when people say, if you start talking about vaccines, for example, well, there you go, you're being political. My argument was vaccines aren't inherently political. They've been made political, right?
Yes.
And that somehow that people who have an opinion about a truly political policy conversation about, let's say, I'll just throw out random thing, gun control or, abortion or you name it, anything that is truly a political topic. Then if many of them also happen to share, or a large volume of share the same opinion on something that is not inherently a political topic, right? It should be maybe a warning sign that you've veered into, somebody has drug a non-political topic into a political sphere and it's influencing people's decision making. And so the idea that something that was pretty much considered settled science for a very long time, as much as there can be settled science, again, knowing that things change over time, et cetera, and that it's not a case of, and I'm going to say this little part, talk about soapbox, and then you can, correct me or affirm or whatever. It's not a case of saying, it is political conversation maybe, or policy conversation to talk about making people having vaccines taken, right? That if you're going to force a population to take a vaccine, that is a policy conversation by nature. However, people making policy decisions should be basing that on real information. So in other words, I understand that the measles vaccine is an extremely low risk vaccination for my child to get. However, I am still adamantly opposed to the government saying that we should do this. And I accept the fact that children will die from measles, right? That is a justifiable chain of logic, right? We can agree whether we like the decision or the position or disagree on that. That is not the conversation. That's a politics conversation, right? Yeah. But the part that is measles is a wildly safe vaccine to receive. And if you choose not to give it, we have a long history of what it looks like when we don't have a measles vaccination. Or as a friend of mine who worked in the State Department, has worked all over the world in the Middle East, told me the other day, people who think they don't want vaccines should go spend time in a country where they have few, because I've been there. And this idea of what level of risk are you willing to accept because of an ideology? Because eventually reality clashes with ideology, and people's ideologies tend to shift when they see the results. And so it could just be a case of we've got so far away from seeing what measles does to people or polio does to kids, or right, that we just forget what that looks like. And now we're willing to put a line in the sand on something political. Shelly, what do you...
100%.
Yeah.
I mean, I totally agree with everything you just said. It is very much I get the question like, well, have you seen this before? And I'm like, to be perfectly honest, no, I haven't seen measles. I have not actually taken care of a child with measles, because I graduated in 2000. I don't even know. I don't remember when I graduated, 2009. I haven't, because everybody was getting most people were getting their vaccines at that time.
Yeah.
But now we have these emerging cases. I mean, in January alone, there were like 1,000 or so cases of measles across the country. And that's not, my generation was not trained in that. We know about it. I know all the symptoms of it. I know what to look for. But if it came out in front of me, I can't tell you that I've actually seen it.
I'm looking forward to just bringing back some full-blown plague. Let's just go bring the rats, bring them on the.
We had it already.
Yeah. Some of these things never left. And I joke, but the thing is, this idea of, well, yes, we're going to get more measles. We understand that, but we're going to get less autism, or fill in the blank. And where the general public struggles, and this is where that lack of understanding outside of medicine and just science in general and how the research body works of it, and the when you bring in confirmation bias and then groupthink, right? When you bring a bunch of people together that have the same opinion, reaffirming each other, right? Is this idea of, and this is where Melissa and I can speak with some expertise on this idea of, has there been a rise of diagnosed autism? Yeah, absolutely. But the question that people can't answer, and I can say anecdotally, which means nothing, but I can say anecdotally, has there been an actual rise of actual autism, is a whole nother conversation. And there is an argument and a very legitimate debate about whether autism itself has actually increased. And I can tell you, I've been walking through classrooms for over 30 years, and you can still visually see, and you can ask teachers, from the 90s or the 80s or 70s, tell you, oh no, we had that. We just didn't know what, we called it something else.
Right. It just wasn't diagnosed.
Yeah, wasn't a thing. And in the 90s, for example, it really started to be something that was looked at a lot more carefully. Education experts started really showing up on the scene. It became almost, I don't mean this in a negative way, but an industry to study these underserved population of kids who were misunderstood because of something they had. And a lot of people trying to do the right thing for kids started really putting out good literature, good. And then all of a sudden people are like, well, and there were doctors, I know particularly in Scottsdale where I was working, that was their single business. If you had a kid you thought had autism, you take them to that doctor and he'll give them the label give them the label if they run through the battery. Well, that didn't exist. That never existed 10 years earlier. And so does that mean that a vaccine may not cause autism? It doesn't prove anything, but it should raise significant questions when you ask yourself, are we willing to bring measles back? Right.
Yeah.
When it is far from conclusive that immunizations, or even suggestive that these immunizations are causing a drive in autism. I almost, that flew out of your mouth so quickly. The vaccines thing, it almost caught me off guard.
It's always, it's on the tip of my tongue all the time, just because it's so, like, right now is just.
Well, and actually, before I let it slip away, let me just do a quick follow-up for, because some people say, well, so there are these, communities in Texas or in, these random spots around the country in the Carolinas where now we're going to see these measles outbreaks. And yes, we're seeing it, but, it's not really going to affect, but this idea of herd immunity, and the idea that just because you're vaccinated for measles doesn't mean you could never, ever, 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 ever get it. And my understanding is, and correct me if I'm wrong, the idea is that if you start inundating kids that are vaccinated with the measles virus, it will get through, because no vaccines aren't 100%. They just, is that right? Is that really why people who have vaccines and are vaccinated for measles should be just as concerned about this conversation as we are?
Yeah. I mean, so your general measles, mumps, rubella vaccines are given when you're a young child. So 1-year-old and 4-year-old are your, 4-year-old's your booster. I mean, from, speaking from a personal aspect, for me, my daughter is 3, so is not yet technically eligible to get that 4-year-old vaccine. She's been vaccinated once against it. And so being in a high exposure job and knowing that I'm in my late 40s now, that my immunity may have waned over time, I got myself checked and got my titers checked to make sure that I'm still immune. I still have some immunity to it. That doesn't mean that I'm going to be completely immune to it, because I could still bring it home and she could still get sick.
Right. Yeah, that makes sense. That's a kind of a scary proposition. Julia, I want to make sure that we talk about something that I think everyone in the audience would find fascinating, and including the three of us and everyone else, is, that aforementioned conversation we had in the back of an Uber. Or it wasn't an Uber, that was your son driving. What am I talking about? It was kind of like an Uber, one of his first times driving. I remember, that was great. So anyway, and I get motion sick very easily, and I was able to be in the back seat. That's how good of a driver he was.
Yes.
So as a 16-year-old. So, Julia, I want to can you talk a little bit about the concern you were talking about with the energy drink phenomenon and the cardiac issues with young people? This was fascinating to me. I had not heard this anywhere.
I'm curious.
Yes. Yeah. So energy drinks should not exist. I mean, I'm just going to say it. I think they taste really bad, for one thing, but
Agreed.
yeah, but they're just not good. The level of caffeine or other things in them is out of control, and it's not a natural substance. So what is it going to do to a body? Not good things. And we've seen a rise in SVTs, which are it's a tachycardia that comes from the top part of the heart. Okay, we've seen a rise in that, atrial fibrillation in younger and younger and younger people. Now, you can look at it two ways. Like, it's not causing it, it's bringing it out. Like, you have to have a predisposition in your heart to have these rhythms happen. It's just coming out earlier, and something that, we used to think that AFib was only older people and that's part of aging, and these people, well, not necessarily. So now we have 20-year-olds on our table, and you ask them, well, what are you drinking? What are you taking? All these kind of things. And it's this high level of caffeine that's triggering it, if you will. Yeah. And it can be bad, because it's not just a fast heart rhythm that feels yucky. It's sustaining these rhythms can lead to heart failure. Sustained AFib can lead to strokes because it forms blood clots. The heart's not beating properly. So it's a really scary thing, because they think it's this benign drink, and, oh no, it's just bad for me because it's a lot of sugar, a lot of caffeine. No, it really is doing harm. It really is. Yeah,
you were describing like actual cardiac events for like teenagers when we were talking, which is scary.
Well, that's just it too. Like, cardiac monitoring as a young person isn't, you just don't do it. You don't get really EKGs until you're a lot older and that kind of thing. So what if you have Wolff Parkinson's White, which is a really dangerous fast rhythm that you're essentially born with, but it doesn't trigger until maybe you're in the 20s usually. But it can happen in the teens. And what if you've accelerated that by something that you're drinking? You know what I mean? That could be a fatal rhythm. So it's really kind of dangerous, or you see these kids collapsing on sports fields and stuff from not the same thing, but you just don't know. So why make it worse?
Yeah. And you're right when you talk about, I know I've seen some of the labels on the big, especially the bigger or the Monster drink. If it's called Monster, it's probably a bad sign,
Yeah.
Clearly, we don't. First of all, we don't have any sponsors for this show, because we just do this for the love of the conversation. Yeah. Like, if we did, it certainly wouldn't be Monster after this episode. So, yeah, really good insight. So I hope that parents, and I know that a lot of parents struggle with, but if I tell my kid they can't have that anymore, they're going to go, but mom, and you know what? Let them go, but mom, right? Kind of thing.
Right.
A couple of mothers who are very effective mothers. You guys know that sometimes you guys don't care.
Well, and that goes along too with all of these supplements that are being hawked on the internet, and like, oh, it's gonna, I'm 45, so my entire feed right now is like perimenopause and all this stuff down. It's like, God, somebody change my algorithm, please. But natural doesn't always mean safe.
Right.
And something that you're prescribed may interact with these natural supplements that you're being told can help you. And so, it's, you need to be honest with your practitioners and what you're drinking, what you're eating. All of these prepackaged and overprocessed things, those, if you can't say the word, you probably shouldn't be eating it or drinking it. So, yeah.
My favorite are like the families that come in, they're like, oh, my kid's not eating or drinking anything, but their fingers are like orange from all the Takis.
Right.
Mm-hmm. And then their bottle has like Fanta in it.
Yeah.
Right.
And the child has tinted the color of the food they're eating, right? Like, yeah. And I think, in your experience, both of you, why do people, why do, I think we know maybe, but why do people lie to their doctor and nurses? And what could you say to them to make them, to help them understand that how harmful that is? Like, how do you get through to people? Like, I need you to be honest. And what would you say to an audience listening about how critical it is to be honest?
I think people are embarrassed, first of all. And they don't know what they don't know. So they try to fix it first.
Right.
And it's dangerous because what we might have to do to fix it for real might not work because of what you've already done, or might interact with what you've already done and make you sicker. And so I think it's okay. We've seen it all. I've seen it all. You really cannot shock me at this point. And when
stories you have.
Oh yeah, it's great. Michael's heard some of them. So yeah. Yeah. But I think
no words, never names names.
No, never. No, I probably don't remember them anyway, but I can remember your creatinine level, but I won't remember your name. But yeah. Yeah. But yeah, I think it's fear and shame and, insecurity and all of these things. They don't really want to say that they've screwed up, and that's okay if you have. You're not going to shock us. We just need to know so we can help you.
Yeah. And it's funny because, being in the pediatric space, like I don't get the dishonesty. Actually, I get that the parents are too honest sometimes. They will tell you every small detail about everything because they think that it's pertinent, which it might be. And it's not until the kids are about pre-pubertal, so maybe like 10, 11, 12, kind of, when the parents just don't know all the stuff, and then the kids are hiding things. Mm-hmm. Because they know most of the time they know they've done something bad, and that's not the way it's supposed to be.
Yeah. Yeah, Melissa, I know that you had a couple that you were dying to make sure you got to ask, and I don't want to, because I just get going. I get so excited to ask all these questions because we've had them teed up, and I've just been thinking about them, and I know there were a couple of these.
She doesn't play, and then there's right.
Doesn't play well with others.
So I guess I'll ask just one because we're at that 1 hour mark, and I want to make sure that we have time to close out to
1.5 hour mark.
There are things that you do in the course of working with patients that are pretty emotionally charged. And it might happen at the beginning of your shift, and you still have to get through other patients and other procedures or deal with other people. And so how do you basically compartmentalize so that you're able to deal with a tragedy at, 10 o'clock in the morning and still be able to function for the rest of the day and be present for your other patients?
It sounds bad, but you just have to turn it off. If you got emotional or, wrapped up in the story every single time, you won't come back to work the next day. You just won't. You can't. So, with family tragedies or, issues, I am notorious for being kind of, I think an outsider would say maybe cold-hearted or stone-faced, about it. But that's just how I'm trained. That's just how I have to be. And then I'll fall apart later kind of thing. So, yeah, it is hard. I remember one day We had 8 heart attacks come through our department in 12 hours. 8.
Wow.
8 patients. And you know what? Not every one of them was a crash and burn, but a couple of them were. And, you know, the pager went off again, and you just have to do it again. And so, yeah, I don't know. You just kind of have to put your humanity aside for a second, your own humanity, not the humanity of taking care of people, but your own emotions and your own physical connection to the situation aside, and just to keep going.
Mm-hmm.
Really good.
I think that the adult world obviously has more of this than I generally experience. I don't work in the ICU setting, so I probably don't see it as much. Have I seen it? Absolutely. I agree with Julia that you just sort of, you compartmentalize. You're taught to be professional and not necessarily personable, or personable to an extent. That being said, in the world of, I think I had seen something about, you know, Melissa, maybe one of your questions was like, have you ever, you know, cried when you've been at work?
Yeah.
And I absolutely, I have. I mean, and when you're dealing with a child, I think sometimes it's, you know, they haven't had a life yet. They haven't had a full life yet. And so sometimes it's a little bit different. And sometimes it's a little bit more that you're emotional for the parents more than you are for the loss, or for the loss of the life for the parents and what they're about to go through. And so it is, and I've done it at work. I mean, I'm not sure that you take a minute and you sit with a family and you do what you need to do and how you need to do it. And then you say, I'm going to give you your space and I'm going to take some space, and you separate. And what I've done is always come back to that family, because it's just something that sticks with you. And obviously they're in the hospital with us for a number of days often.
Yeah.
So you have that opportunity, but it's not fun.
Yeah.
Yeah.
It's a yeah. And like Julia, you know, you get through the rest of your day, and then you go home and you sob in the shower, or you let it all out to your partner, or you go outside and you scream.
Mm.
Sometimes it's just what happens.
We talk about compassion fatigue too, and that's that, you know, we in education have teachers that are really invested and go and go and go, and we call it burnout for educators. Mm-hmm. But compassion fatigue is also something that's real with the medical profession too. How do you manage that? What does that feel like? And how do you manage that? Besides going out and yelling or crying in the shower.
Yeah, I think it's sorry, go ahead.
No,
I think it's important when you have a good team around you, and I really do in what I do for a living, because you can have those really bad days, and you know that you're there for each other to keep each other going, or to cry to, or whatever. So, and the older you get in your career, it is easier to handle, I guess. Because you have seen a whole lot of it. And there are times where it's appropriate to cry with the patient or with the family. It is in that moment. And especially in nursing too, because that is part of your job, to be the emotional support, you know, for people. Or you go out into that waiting room after a patient has passed with that doctor, and you're there with them. So I think the team around you is really important, because you do get fatigued to do that. Not just physically, but it's like I said, that one day I'll never forget. And it was literally 15 years ago, and I've never forgotten that day. But the team got each other through. So yeah.
It's one of those things where I think, you know, I think it's a reminder when people hear this sort of thing that, you know, even though sometimes, you know, the profession is, you know, nursing or doctors are presented as almost a monolith, right? Like this idea of this, right, singular, you know, white lab coat and a stethoscope kind of vibe, but that there's a human being there who's trying to navigate very complicated situations, not to mention their own complicated lives and the stuff they're dealing with.
Right.
And why, you know, remembering, just like in any field, whether it's someone we're dealing with, at a restaurant or, at a car, any place, you name it, that we remember there's always more to this story. And I always think about how hard it must be for medical professionals to be in because in a lot of times it's no win, right? You're in somebody's most emotional core space. You might get looked at sideways if you don't show emotion. You might get looked at sideways if you do show emotion. And then most importantly, when you show the emotion, right? Like, so there's all these things that have to be, and then you're also just trying to navigate your own survival in the field to be the best doctor and nurse you can be. How hard that has to be and how complex it is. Well, before we move into the wrap up, I do want to just loop back on one last concept. And I want to go back just real quickly, then we'll close with a rapid fire. What's one last thing that if you could eradicate from these shows or a show in its entirety, or just from anybody's mind, because we're out of time, and who knows, maybe we could do a follow-up to this sometime based on questions we get, have you guys back because you've been such a great guest. And you're on time and that. And so I do want to go back to this idea because I do think it can be a pitfall. The notion of, well, go to your doctor, and when it comes to vaccines or when it comes to something that's controversial, I saw something on TikTok and I'm really going to go to the doctor, and if they, and I have seen this be identified as a potential slippery slope as well, because we just got to talking about doctors are human beings. And doctors and nurses, as much as they are trying to anchor themselves to what does the preponderance of the evidence say, what does the New England Journal of Medicine and other peer-reviewed journals, for example, say? What does the bulk of the data tell us? These are still human beings that also have ideologies themselves, right? Just like teachers have ideologies, and so. I do, and I've heard this discussed in other circles, that, the concern that of the idea of I'm going to find a pediatrician who thinks that measles might cause autism. And I'm going to keep going to one until I find one. And if I can find one or two or five, then that validates the fact that measles vaccines may cause autism. And the idea that just because you can find a medical professional that does look sideways at the vaccine, for example, that's the person for you because you're ideologically aligned and they believe what you believe. I kind of have an adage that belief isn't part of this conversation, right? It's what does the evidence say, right? And so, so am I wrong in saying, Shelly, I just mentioned the measles and the vaccine again, but I don't think am I wrong in saying that, look, you can find people with the right credentials that believe a wide range of things that is far outside what the evidence is saying. Is that or is that not true?
In my experience, I would say that you'd be hard pressed to find a board certified pediatrician that would say that measles causes autism, just given that there is no like research or evidence-based anything that shows that.
Right.
However, I will say that there are, I think to combat that, pediatricians then pediatric offices then offer delayed schedules, or let's talk about just doing the really, really pertinent vaccines to keep your baby safe. And then if you want to do hepatitis A and flu and COVID and things like that, we can talk about that kind of stuff later. There are other medical practitioners that you can absolutely find that have no problem with you not vaccinating and will not treat your child any differently than they would if they were vaccinated.
Yes.
And I think what families don't understand, and we have run into this quite a bit recently, is that when a child comes into the hospital and is being hospitalized for whatever diagnosis, and they are unvaccinated, the list of things that could potentially be wrong is exponentially longer than it would be if your child was vaccinated, because you're dealing with things that you don't see on a regular basis.
Right.
And it usually means a longer hospital stay. It usually means a bigger workup. and things like that. And then yeah.
Well, and is it also in line, not to just spend all the time on vaccines, but it also comes into play with other things. For example, I think I've heard it talked about that, some things are just really complex, right?
Absolutely.
So sometimes a doctor or a practitioner or nurse, there isn't enough evidence for them to tell you one way or another. And their uncertainty isn't a validation of something you picked up from TikTok, right? So for example, if there is some evidence that dramatically reduced, I'll just use something that comes out in, very common. And I know there's some elements of truth to this. For example, is there some evidence that reducing carbohydrates and and that maybe a person can eat a lot more protein and a lot more fats than what has been talked about in the past in their diet, if they're doing all these other things, and maybe there has been some stuff that could be studied more about that, and that there are some legitimate conversations going on and things that are being learned every day about the way the body works, et cetera, et cetera. However, that doesn't necessarily mean that some is good, more is automatically better. And that means that you automatically can run the gamut and say, see, they've been all wrong about this, that you should have some greens. So now all I'm going to do, right, is go completely the other direction. And because this one thing that fits my level of understanding, right, something that has been translated into a way that I can understand it, makes me feel like this is the way to go. When the human body is so much more complex and dynamic than an oversimplified article. For example, like I know one of the things that is really talked about is gut health, right? And the microbiome, and what they've learned about how important keeping a healthy microbiome is, and the effect might be having psychologically on people, and et cetera, and that it's this really complex interplay that we're always striving to understand more. When I say we, I mean you guys. Try to understand more. And so someone might get a hold of the microbiome thing and say, well, now I'm just going to, I've heard about fecal implants and I'm going to run and do all these things, right? Like, because you can and because we want to rush to that solution of this is the answer, this is the holy grail, that we might rush to things that are dangerous. And then if we run to our doctor and say, well, I read this, and they might give you what you consider to be that doesn't necessarily serve as a potential validation of what you're doing. It just simply means that we don't know yet, and that there's always what I've learned just from trying to dig. Every time I find something, I go, oh but let me look a little bit deeper. Is there turns out to be something else I didn't quite understand, and it's because guess what? I'm not a scientist and I'm not a doctor, right? And so I didn't understand that. Yes, if I take zinc, it might be great, but what I didn't understand is, I'm just making this up, is that it can't penetrate the cell wall without the right amount of copper. And so you're taking all the zinc and all you're doing is stressing out your kidneys. I'm just, making that up, but that it's far more complex than we ever realized. So don't assume that I can't shoot you down, the doctor can't shoot down your theory, isn't necessarily right affirmation. And some doesn't mean automatically that you should go 110% in a direction, right? Does that make sense? Am I saying anything that's not? I usually say things that don't make any sense.
You're pretty spot on.
Okay, I just want to, because I've really tried to do my own research. But what I like to do when I think about doing my own research is what do the bulk of the people who know their shit say? It's really that simple, right?
Yeah.
There's a reason you guys spent years and years and years and years and years learning this stuff at a deep, complex level, because it's complex stuff, right? So, and so there's so much more that I really want us to get a chance to talk about, and maybe we can do a follow-up. But really quickly, before we get ready to close out, Julia, is there anything that's just like, this is the one thing that I wish they would just wipe off the screen forever in a medical show, or this is the one thing that if you could change tomorrow to the audience, do this one thing? Is there anything that's just you want to make sure you get out before we close up?
I guess my last thing I want to say is, like, medicine works best when patients partner with their physician or their nurse practitioner or their nurse or whatever, like, and they're not their own detective or they're not a passive bystander. Like, it doesn't work that way. We need to replace the, prove me right or prove me wrong scenario with help me understand instead, and put it all on the table and say, this is what I've read. Is any of this true? and don't be mad when they say no, that kind of thing. Like, this shift alone can change outcomes in patient care.
Really good advice. You probably don't see a whole lot of that sometimes, but Shelly, any one that just you want to make sure you get out on the table?
I have a couple, but
where Noah Wiley doesn't count as one.
Probably the biggest one, the biggest complaint I get is, why haven't I been seen yet? And my response to that is, you should be glad that you're still sitting and waiting. Your doctor's probably, if your doctor's not running to your bedside, that's a good thing. Mm-hmm. So be patient with your physicians, give them some grace, or your physicians, your nurse practitioners, the whole staff, give them some grace, because if they're not rushing to your bedside, they're probably rushing to somebody else's.
Oh, yeah, that's a good
Absolutely.
And that's where some of the old shows used to lead people astray, because it made it look like they were all out having conversations about who was dating who instead of seeing their patients. And the Pit does a better job of showing most people don't have time for that kind of stuff, right? So, all right, well, awesome. Well, I just want to sum up with just this idea of, we're going to continue to talk about the interplay between how the psychology of how we work as humans is just as impactful on how we view medicine, how we view our experience interfacing with people that are out there trying to save our lives and do the good work, or extend our lives as best as they can, in partnership, hopefully, right, Julia, with us, trying to help us extend our lives and lead longer, healthier lives. And we will do a follow-up and revisit some of these themes. We'll take some questions from audience members, and we'll come back and we'll just do a debrief with us, and then maybe we'll be fortunate enough to have a couple of our favorite people back on again, and see you guys again. So we really want to thank you for taking your very valuable time. You're both full-time professionals and full-time parents, which is incredibly daunting work as well. And I know you're rushing off to do the parenting stuff or work stuff here as we wrap up. So thank you so much for tuning in. We will look forward to hearing comments, hearing follow-ups. And as Melissa likes to say, remember to
subscribe and like. Make sure that you're subscribing. Even if you didn't listen, give us a 5-star rating. It helps other people find us. And we know that there are a lot of people out there that need to hear these conversations. So make sure that you subscribe to the show, like, and leave us a comment. We like to hear how our listeners are reacting to the things that we're putting out.
And just because we have 450 friends on Facebook, you're not really my friend if you haven't subscribed at least. You don't ever have to listen. You don't have to listen. I understand there's a lot of great people you can listen to, but come on, help us out a little bit. So, all right. Thank you, everyone. We will see you on the next episode of Unlearning Out Loud. Take care.
Take care.
Thank you for having us.